Hello and welcome. I'm Dr. Jyotsna Mirlay from Life Clinic, Bangalore. Today I will be speaking to you about polycystic ovaries. It's a condition which affects a group of women who come to a fertility clinic, and it seems to worry them a whole lot. So this is going to be a video to just reassure everybody who's watching this that it's not something that you need to worry all that much about. Let's start by looking at the word polycystic. Poly is many and cystic is tiny little spaces in the ovary. So this is how an ovary looks when you go through a transvaginal ultrasound. You would find that the ovaries are a little larger and filled with 25 or 30 tiny little cystic spaces. Now these cystic spaces are nothing but little follicles which are just there sitting immature. They haven't matured enough to release a good egg mid-cycle, and each month it just keeps going on, and then you end up having larger ovaries with many tiny follicles. So understand that polycystic ovaries is just the way the ovary looks when you do an ultrasound. Now sometimes you might find that polycystic ovaries also has other symptomatology, like you might have women who have menstrual irregularities, you might have women who have obesity or acne or hirsutism or hormonal changes, and then when this happens along with the scan appearance, then we would probably say that there is something called a polycystic ovarian syndrome. About 40% of women in their reproductive ages could at some point in that time be diagnosed with polycystic ovaries, and there is proof now that it's inherited genetically. So it's not uncommon that you would find a woman telling us that her mother or her sister or her aunt would have been having similar symptoms sometime in their life. So it is quite common to have groups of women in a particular family having similar symptoms. And when women do end up coming to a fertility clinic with polycystic ovaries, the reason why they would probably need help from a fertility specialist is because women with polycystic ovaries might have trouble ovulating, or we term it medically as anovulation or a lack of ovulation. So this could be the thing that prevents her from getting pregnant naturally. But having said that, large groups of women who have a diagnosis of polycystic ovaries would probably sail through life without even knowing that they have polycystic ovaries, and they could just ovulate and get pregnant on their own. So if a woman does have polycystic ovaries, how do you diagnose it? Well, ultrasound scan is a good way of looking at the ovaries, and if there are other symptoms like what I mentioned, then you could probably need hormonal tests and such other things to make a proper diagnosis. Now once a diagnosis is made, what do we do? Well, I would like to say that the first thing I want to do here is to reassure everyone who's watching this that polycystic ovaries is not something that you need to be afraid about or worried about or think of it as kind of an endless thing where you are not going to get pregnant at all. It's not one of those things. It's not a disease. So when people ask me, can I get cured of polycystic ovaries? I oftentimes tell them that it's not a disease, so you can't get cured. It's just a condition, and sometimes it could get better, sometimes it could get worse. When women gain weight, we find that the whole symptomatology of polycystic ovaries gets worse. When they lose weight, when they're active, when their metabolic rate is fine, then we find that a lot of symptoms are abated. So a lot of these things could happen as an up and down through your reproductive life. So what do we do? Well, primarily we start by counseling, and we would like the woman to lose some weight. So I think this is a very empowering suggestion that can come from a doctor, because this alone can help a large group of women with polycystic ovaries to ovulate and get pregnant all on their own. Now the good part is polycystic ovaries happens most often to women who are young, and they are otherwise very healthy, and they have most of the times fertile partners. So getting pregnant with a good amount of weight loss should work well in helping you to get pregnant. Now there could be a small group who is not helped by weight loss alone, and there you could seek some medical help to induce ovulation. Induction of ovulation can be done with simple things like tablets, or we could use the newer drug delivery systems like these pens. Now these pens will inject small doses of hormones inside your body such that you will be able to grow 1 or 2 eggs every month, and this does away with risks of overdosing and hyperstimulation and forming of too many eggs. So that is something that can also help you to achieve a safe and healthy pregnancy. A small group of women who do not do well with medications might sometimes require surgery, and that is done by laparoscopy. So there is a hope for some women to go through laparoscopic drilling and help to get pregnant there. So it's all about what works for a particular woman, what works for her physician, and what are the facilities available in that particular unit where she's consulting. So end of the day, it is very, very possible and quite easy for a physician to help a woman with polycystic ovaries to get pregnant. So in conclusion, I would like to reassure all women watching this that please do not think of polycystic ovaries as a huge obstacle in your attempts to try and become a mother. It is something that you yourself could probably help to overcome, and simple things like weight loss and improved eating habits and exercise could go a long way for you. And if it doesn't work that way, then there is always safe, good methods, both medical and surgical, which can help you to get pregnant. So I think that it is something that you need to understand and be understand your bodies and be gentle about what you're doing to yourself. Be confident. I don't think there is any need for you to lose hope at all when you are trying to get pregnant and if there is a diagnosis of polycystic ovaries that has been made. So I hope you found this reassuring, and thank you for watching it, and let me conclude by saying Merry Christmas.